On September 16th, NIH released both the final rule for FDAAA and the new policy on clinical trial reporting. These two important documents will result in significant changes to the way that grants for clinical trials are assessed, awarded, and managed, as well as making important changes to how the studies are registered on ClinicalTrials.gov. While there have been no enforcement actions to date, the final rule and NIH policy both make it abundantly clear that will change after the compliance deadline of April 18, 2017. Under the combination of the statute, the final rule, and the NIH policy, failure to comply can result in loss of NIH funding, as well as fines of up to $10,000 per day. Just to give you a sense of the scale of risk, NIH's reporter database shows an annual investment of more than $3 billion in clinical trials. If compliance remains at its current rate of just 37%, that leaves 63%, or almost $1.9 billion of NIH-funded clinical trials, at risk. Who can afford that? By the way, we have provided links to several important publications that not only provide details of the rulemaking and new NIH policy, but also give you context and background within which these changes are being implemented. You'll find these links in the FlexLinks document located below the video window on this page. Simply click the FlexLinks button, and the document will open as a PDF for you to review. The statute and final rule require clinical researchers to register their protocol within 21 days of patient enrollment, keep this record up to date throughout the duration of the study, and finally, to post summary results within 12 months of the end of the study. The final rule includes a lot of changes in how protocols will be registered and result summaries reported, including the requirement to post protocol and statistical analysis plan, registration for unapproved products, clearer outcome measure reporting, and more frequent updating. The NIH policy requires separate grant applications for clinical trials, mandates full FDAAA-like reporting for the results of all NIH-funded clinical trials, not just those currently subject to FDAAA, and finally, builds the requirement for timely and complete registration on ClinicalTrials.gov into the terms and conditions of the award. Again, the critical implication here is that non-compliance with either requirement would result in loss of NIH funding as well as penalties of up to $10,000 per day in fines for each non-compliant study under FDAAA, plus possible criminal penalties. Obviously, you don't want to risk losing any part of your NIH funding, so as enforcement of these new measures looms large, you need to find the most efficient path to compliance for your clinical researchers. We suggest you begin with a simple, 4-step process: assess, communicate, train, and oversight. Beginning with assess, we offer a free risk assessment for any US-based academic medical center that requests one. That helps you jumpstart your process by understanding where your organization is regarding compliance with FDAAA and the new NIH policy. This sample chart is taken from our risk assessment. It compares the rate of timely protocol registration for both an individual institution and its peers, as measured by both the FDAAA and the important ICMJE deadlines. As you can see, overall, the compliance with FDAAA is low, and compliance with the ICMJE mandate to disclose before study start is even lower, meaning that the majority of these studies are likely to be rejected by journals that follow the ICMJE guidelines. We are preparing this analysis for any US-based academic medical center that requests one, and anticipate that it will provide you with the facts you need to underscore the urgency of the issue to executive management. Just click on the Risk Assessment button below the screen, and we'll reach out and quickly prepare your report. But knowing your exposure is only the first step. You need to act on this information to build compliance into the fabric of your organization. That's where the other 3 steps come in. The next hurdle is to help decision makers in your organization understand what needs to be done to put an effective remediation program in place. We offer a number of proven approaches that will not only get attention, but that can be used to quickly build consensus and drive constructive action. When we discuss your free risk assessment, we'd be happy to explain our process and the very limited associated costs. Next, train. The next and most important phase of this process is training. we know that registry compliance at most academic medical centers relies on action by a widely distributed network of individual investigators, and that there are few, if any, process experts to support this complex compliance. Combine this with the fact that the PRS interface is widely reported as challenging, especially for low-frequency users working to report complex result summary data, and you have the recipe for non-compliance. That is where we can be of significant assistance. Please take a look at our Good Registry Practice training courses on this website. This on-demand training is designed to help researchers quickly learn how to overcome specific problem areas for them. Are they puzzled by participant flow or overcome by outcome measures? Again, there is a link lower on this page that will take you directly to our protocol registration or results summary disclosure courses. Browse the course outline, and you'll see how flexible they are. We developed our program in close collaboration with specialists in both the process and in adult learning. Don't hesitate to contact us for more information on our training. While you're on our website, we recommend that you try the free sample lectures to experience for yourself our short, focused video learning lectures. By the way, our registry compliance courses will be updated prior to the effective date of the final rule and NIH policy in January of 2017. And finally, oversight. Compliance failure with FDAAA and the NIH policy presents an ongoing risk to your organization. It is important for each academic medical center to keep a close eye on researchers who appear in imminent danger of compliance failure and to prompt them to complete all required compliance steps in a timely manner. Your team is probably already overstretched. We can help by routinely monitoring your compliance and sending alerts for those studies which are in danger of falling out of compliance. In closing, please forward our email to any of your colleagues that you feel should be aware of the risks of non-compliance and also of our suggested approaches to mitigate these risks. This is an important and potentially very expensive issue, and one where you will almost certainly need to engage with your colleagues to implement effective change in order to avoid losing NIH grant funding or incurring those crippling daily fines. Please reach out and let us help. Thanks so much for your time and interest.